role of health institutions in using the fever clinic and the triage system to identify, detect cases, conduct the testing, and ensure closed-loop transfer of the detected cases to designated hospital for further treatment. Health institutions should work as sentinels to ensure early detection, rapid response, precise management, and effective treatment. Therefore, as we restore the medical services, we should never relent the efforts on 4 Rs. Second, we must have targeted IPC efforts in health institutions with zoned and ventilated disinfection and sanitation measures. In particular, we must screen the infection risks. At the same time, we should set up a good mechanism for the patient accompanying and the patient's visit system to implement the precise prevention and control measures. Third, as we restore the normal medical services, we need to innovate the way of services. For example, the appointment services, staggered visits, minimizing of crowding, one-stop services, the minimization of people movement, reduce the cross-infection risks. At the same time, we leverage telemedicine to combine the online and offline services so as to effectively provide patients with the appropriate services to satisfy the needs of the general public for their ordinary and normal services. We have combined measures. The health services provided across the country has come back to 85% of that of last year. In some regions, the normal medical services have been restored completely. Thank you. Next question goes to the journalist on the second row on the right side, please. Thank you. With Phoenix TV. I have a question on diagnostic and treatment protocol from version 1 till version 7. There has been updates on the epidemiological criteria, the criteria for the case separation classification. What has been the major change in the evolution of the protocol? I'd like to ask Director Wang Guiqiang to take the question. Thank you for your question. In the context of unexpected COVID-19 outbreak, we had many unknowns on the disease. With our deepening understanding, we've been improving and changing the versions of the protocols. We emphasize on the reduction of 2 rates. First is the incidence rate. Second was the CFR case fatality rate. The control of CFR depends on the efficacy of clinical treatment. NHC has adopted an array of measures to reduce CFR. An important measure was to rapidly change and update the protocol. The rapid protocol updates have played an important role in reducing CFR, and these updates were emanating from the scientific research results, our deepened understanding of the pathogenesis, the clinical outcomes, and the clinical experiences. The diagnostic and therapeutic protocols started from the first version on 15th of January till the 7th of March, which was the 7th version. Within a short span of 2 months, we have provided 7 updates to the protocol, solving a lot of clinical issues. For example, diagnosis has evolved from NAT tests to serological tests, and pathogen detects. From the very beginning, we used pharyngeal swabs. Later, to improve the sensitivity, we've used nasal swabs and sputum, and also the lower respiratory tract sample testing.
More importantly, for clinical treatment, there have been some updates, such as the treatment strategies. And at the start, we recommended some medications which are readily available, and later we also recommended many other therapeutics like the convalescence plasma. And then in the 6th version, we specifically updated these recommendations. And also from the developments of the updates and epidemic response, you can see that they have been constant improvement and evolution. Then the 7th version is quite sound and comprehensive. In terms of the development of the symptoms, we also made constant update to the technical guidelines, and then we integrate them into the technical guidelines specifically for different population groups. Another example is the treatment to the severe cases. At the start, we just emphasized the oxygen therapy and the supporting practices, but gradually we specified the details of the medical approaches, like the use of ECMO, and also, just as Madam Guo has mentioned, the MDT approach, because gradually we found that the case fatality rate among the elderly patients was quite high. So with the MDT approach, we can reduce the case fatality rate. Also for TCM, the proportion of TCM medication has been constantly increased. So in general, we can say that the updates reflect our understanding of the virus and the disease, and also with the biopsies and the autopsy results, we gained more knowledge and understanding of the disease. So the rapid updating of the technical guidelines and clinical protocols have been used in the clinical practices and have been turned out to be very helpful. Okay, let's continue. On the right, on the 5th row, the lady reporter, please. Thank you. With Hong Kong Economic Herald, we know that the Children's Hospital of Beijing has received the children patients all over the country. So how are you going to return to the normal operation after the COVID-19? We will have President Ni to take the question. Thank you for your question. As we all know, for children's diseases, the symptom developed very fast. And since the outbreak of COVID-19, we have always balanced the COVID-19 response and the daily treatment and operation of the children's hospital. At the moment, as we all know, that patients from the low-risk areas within the country do not need to be quarantined in Beijing. So parents can bring their children to our hospital. They just need to take the body temperature checked and have the triage. If there's any fever patient, the patient and the parents will be guided to the fever clinics. In visiting the doctors, we also hope that for every child patient, there could only be one parent accompanying the kid. So this is about the outpatient department. For the inpatient department, of course, we should not slacken our efforts. For all kids to be hospitalized, NAT test will be conducted. With the negative result, the patients will be hospitalized, and of course we will have the body temperature check and the monitoring. And also for the diseases of the kid patients, we suggest that the parents should not stay in the hospital together with the patient. And in case of necessary, there could only be one parent in the hospital, and the parent needs to take the NAT test, and the parent should not walk around in the ward. Furthermore, the medical professionals working in the hospital are also strictly requested to observe the various practices of COVID-19 response. We've already made specific requirements, and I would also like to take this opportunity and have your support, the support from the media friends, that we need to get the understanding from the patients and their parents, and also we appreciate their support. Okay, on the left, on the third row, the reporter in black, please. Thank you. With Yangtze Daily. My question is, at the early days of the COVID-19 outbreak, we can see that the number of severe cases surged in Wuhan, and there were not adequate hospital beds. So how did you manage the situation? We will have Madam Guo to take the question. Thank you for your question. Indeed, as you described, in the early days of COVID-19 outbreak, in particular in Wuhan, in a very short period of time, the number of patients surged. So we were under big pressure to hospitalize the patients and treat them. So at that time, there was a shortage of medical supplies and also the PPEs. It is fair to say that at that time, the logistics team of the Joint Prevention and Control Mechanism of the State Council made a great effort. The local production capacity was also expanded to ensure the needs are satisfied. Also, treatment was always the top priority for the medical community. That's why we've done the following efforts. First, all the national medical teams dispatched to Wuhan were requested to bring with them the adequate PPEs and medical devices and medications for at least 1 week, so that they can use the devices and equipments which they brought with themselves and started to work in Wuhan. Also, many equipments were brought by the medical teams themselves, like the non-invasive ventilators and testing regions. When we did the review and summary, we found that the self-brought medical devices or equipments have exceeded 4,600.
We've also used the medical system to reallocate some ECMOs if we import ECMO, it may take many days. So we emergently reallocated ECMO within the entire national medical system. We reallocated and redistributed ECMOs to Wuhan and Hubei for their emergent needs. With these measures, we have been uniting national efforts to ensure upon arriving in Wuhan, medical workers can immediately get started with their work, and they have the necessary protective equipment and medical equipment to ensure smooth efforts. Next question goes to the journalist on the fourth row on the left side with CNS. In the context of normalized prevention and control, NAT serves as an important prevention and control measures. What is the capacity of China's NAT tests? What are the measures adopted to further improve NAT testing capacity? I'd like to ask Ombudswoman Guo Yanhuang to continue with the answer. As you have rightly pointed out, NAT tests are an important tool to confirm a case. With the testing of a pathogen, it helps to confirm the infected cases. NAT tests there carry important significance for our 4-Earlys implementation, in particular in the current stage. In the initial stage of prevention and control, the NAT tests were carried out by disease control agencies. We know that it needs a P2 level or even above lab to conduct NAT. Biosafety and quality control QC are very important. With the increase in the case number, it is important to improve the capacity and efficiency of NAT tests. It usually constitutes a bottleneck. At the end of January, National Health Commission requires the localities should ensure well-qualified institutions should be ready for carrying out NAT tests. With such requests on the health institutions and the testing agencies, up till now, the daily testing capacity has reached 1.5 million times or units. As the businesses are reopened, we need to further improve the NAT testing capacity. We should ensure the second level and above laboratory building to carry out more NAT tests. Apart from the hardware development, the software is also important in the aspects of QC and biosafety management and standardized management practices of the professionals. Therefore, in the lab management and health workers training, we should promote relevant efforts to ensure after the businesses are reopened, we will have a bigger needs for NAT tests. Next question goes to the journalist on the third row on the right side with CCTV. More children are swarming into Beijing to see a doctor. Parents are very concerned what kind of diseases must be seen in Beijing and how can we help them to seek medical advices in Beijing. President Yi Xing is taking the question. I have answered the first part of your question because parents have the needs to send their sick children to bigger hospitals. Children cannot protect themselves appropriately on many occasions, so we often see trauma or drowning among children. For diseases like this, they must seek medical services in the most adjacent area because for such cases, time is life. And second category of the children diseases are the convalescent sickness of fever, cold, and we also suggest that you seek medical advices in adjacency. Beijing Children's Hospital was established under the National Health Commission. Beijing Children's Hospital in Tiantan Hospital, Shijitan Hospital, and Chang'an Hospital, and Shijingshan, Liangshan, 2 district hospitals. We have set up the diagnostic and treatment centers. Therefore, you can have the specialists providing services in these subcenters. Shenyi Maternal Health Center can also see such patients. Baoding Children's Hospital and the Henan Provincial Children's Hospital are also the sub-branches of us, which sometimes we dispatch doctors over there. In 2013, we took the lead in establishing a consortium of children's hospital. 34 provincial children's hospitals can consult with the specialists from Beijing Children's Hospital. They can also have some joint ward rounds. So it fully reflects the national government's requirement that patients don't have to move around the country. Rather, the physicians will ensure the services can go there. Another category of diseases are chronic diseases like the slow growth among the children, retardedness, and for disease like this, we can deliver the medicines to the families. The fourth category of the diseases are some difficult or even orphan diseases. Beijing Children's Hospital should take more of such patients. Apart from visiting to Beijing Children's Hospital, they can also go to the sub-branch hospitals and they can be transferred to us. They can also use our online apps, and online appointment services to make appointment. Of course, the categorization of the diseases sometimes might be a difficult problem for parents. Therefore, to satisfy the needs of children, we provide 24/7 outpatients and emergency services. We hope with such services we can satisfy every child's needs. They can treat their diseases. They can enjoy the services from our specialists through different channels. Thank you. Next question goes to the journalist on the 4th row on the right side, the journalist near the aisle. Thank you. With the China Youth Daily, as more people have been discharged from hospitals, there has been diversified needs for rehabilitation. How can we accelerate their full rehabilitation? I'd like to ask Director Wang Guiqiang to take the question. Thank you for your question. Yes, as you have said, most of the patients with COVID-19 have been cured and discharged from hospitals. We have a couple of measures to guide the rehabilitation. For the newly discharged patients, they have to stay in home for 2 weeks quarantine, which was stipulated in the 7th edition of Diagnosis and Treatment Protocol. Because we know within the 2 weeks there might be the potential transmission risk or the second retest positive of with NAT. In the 2nd week, patients have to go back to hospital for follow-up visits to go through routine checks, including the lung functions and the image checks. Second, the rehabilitation for mild cases or the moderate cases Most patients in this category have a good prognosis. They don't need special rehabilitation interventions. For severe patients, we need follow-up visits arrangements because they have some potential risks. The lung function restoration might be slow. Some patients even may have the fibrillation or fibrosis with the lungs. So we need to carry out systemic medical observation.
Fourthly, for patients with previous underlying conditions, like the elderly patients, they should also be diagnosed and treated with the underlying conditions. There are also designated hospitals to treat such underlying conditions. Also, we have the long-term follow-ups, because for the infection of COVID-19, it's quite new, and we don't have the medical records for the long-term consequences of the COVID-19, unlike SARS. So we need to have the long-term follow-ups. In this aspect, NHC has already worked out a series of technical rules to conduct the follow-ups. Also, apart from the medical follow-ups, we wish to emphasize the psychological support. The general society needs to help these patients to quickly get back to their normal lives instead of exerting more psychological burdens on them. So for the recovered patients, we do have psychological counseling provided to them to ensure that after hospital discharge, they can also recover very quickly in terms of the mental health or psychological problems. Also, the society is called upon to show care and love to the patients so that they can return to their normal lives. Due to the time constraint, we can only allow one last question. On the left, on the fifth row. Thank you. With the CNR.net, my question is, in the efforts in Wuhan, what are the experience learned by the health authorities in Hubei? We will have Madam Guo to take the question. Thank you for your question. In winning the defense war in Wuhan and Hubei, I think it's fair to say that the medical treatment is the top priority. We have always emphasized the reduction of the infection and the case fatality rate and improvement of the treatment rate and the hospitalization rate. So we have 2 reduces and 2 increases. Also, we emphasize 4 earlies and 4 pooled efforts to optimize the technical protocols, the medical resource arrangement, and etc. We emphasize the efforts at the grassroots level and strengthen the treatment of the mild cases. For COVID-19 cases, you can see that the mild cases represent a fairly large share. However, if the mild cases are not timely quarantined or isolated, they may cause cluster outbreaks, and they may also have the risk of spreading the disease at the community level. That's why for the mild cases, first we need to isolate them, and the most important thing is to treat these cases. During the treatment, we also need to strengthen the monitoring of the symptom development, because for some mild cases, during the progression of the symptoms, they may have the possibility to develop into severe cases. That's why we need to minimize such progression, and also we need to identify the possibility of worsening. So we have adopted a series of indicators to closely monitor the patients and increase the cure rate. Secondly, we are implementing the 4 pooled efforts so that the optimal medical resources can be pooled to treat the severe cases. That is to pool patients, experts, resources, and treatment. The strongest and the most capable hospitals are identified as designated hospitals against COVID-19. And also we have very strong medical teams against COVID-19. Also, academicians and experts are engaged in the group counseling and decision-making to optimize the treatment and reduce the case fatality rate. The third experience is that to have the 5 integrations to achieve the science-driven and precise treatment with a case-by-case approach. In the clinical treatment, we emphasize the clinical studies should be integrated with the basic medical studies, just as Professor Wang has mentioned. Altogether, we have updated the 7 versions of the diagnosis and the treatment protocols. Such updates have accommodated into the protocols the latest findings and clinical practices, so that the clinical practices and basic medical studies are well integrated to optimize the results. The second integration is about the frontline medical treatment and the back office MDT approach. The treatment of COVID-19 is not just about the respiratory system, it is also about the organ support to the other body organs or systems, like the cardiac system. So we have the MDT approach to bring into full play the synergy of cooperation. And the third integration is about medical treatment and care. For the COVID-19 patients, they are hospitalized in the wards, and all their care needs are satisfied by the nurses. Also, we have severe cases and critical cases who are elderly patients with underlying conditions. That's why nursing is extremely important, especially for elderly patients and also for critical cases who require the prone position ventilation and etc. So we have such integration. The fourth integration is about medical treatment and management to ensure the quality and the performance of treatment. We have set up various practices or mechanisms, such as the reporting mechanism for the cases within 24 hours, and also the discussion on the specific symptoms and conditions. And the fifth integration is about the TCM and the Western medicine integration. The TCM is also given a play in the treatment of the cases. With such integration, we really made a sound achievement. Thank you. During today's press conference, we have speakers talking about the medical assistance to Hubei and also the resumption of the normal medical order in the hospitals. Now the localities are working on COVID-19 response as well as the resumption of work and the production. So for tomorrow's press conference, we will talk about the regular prevention and control efforts as well as the occupational health. We will have experts from NHC and officials from NHC to give us answers. That's all for today's press conference. Thank you.